I hope you're having a great day today. Today we are talking about cardiovascular exercise technique. This is chapter 14. Here we go. So our objectives with this chapter are to identify recommendations relevant to cardiovascular activities, as well as to provide advice regarding proper exercise technique on many machine type cardio activities, and discuss how clients can participate in group exercise classes safely, as well as to describe how to match clients with cardiovascular activities that are compatible with what their interests are and their physical capabilities. There are recommendations based on the Physical Activity Guidelines for Americans, the second edition, that are published by the U.S. Department of Health and Human Services, which is with the Office of Disease Prevention and Health Promotion. They recommend how much physical activity we need to be healthy. The guidelines are based on current scientific evidence supporting the connections between physical activity, overall health and well-being, disease prevention, and quality of life. Cardiovascular endurance is a measure of how well you can do exercises that involve your whole body at a moderate to high intensity for an extended period of time. Improving your cardiovascular endurance can make it easier for you to carry out your daily tasks. It can also lessen your risk of diseases such as diabetes, heart disease, and stroke. You can raise your level of cardiovascular endurance by doing exercises that increase your heart and breathing rates, or aerobic exercise. According to the experts, aerobic exercise is the most important part of physical fitness. To achieve cardiovascular endurance, you should exercise aerobically 30 minutes per day, 3 to 7 days per week. When you do aerobic exercise, your body responds, and that your heart pumps more efficiently, as well as your lungs. Your blood volume and delivery system are improved. Your resting heart rate is lowered, and your heart pumps out more blood. Your muscles get stronger, your ligaments, tendons, and bones get stronger, and your body's able to use fat as an energy source. As you increase your cardiovascular endurance through aerobic exercise, you'll get stronger and fitter. And there are other benefits associated with it as well. A lowered risk of disease. Aerobic exercise reduces your risk of developing many diseases, including heart disease, high blood pressure, obesity, type 2 diabetes, some types of cancer, stroke, and you have better strength and stamina. Your heart and lungs will get stronger as you exercise, so you'll gain bone and muscle fitness. You may feel tired when you first start exercising, but you'll develop stamina over time. A more active immune system. You're less likely to catch viral illnesses such as colds and flu if you are a regular exerciser. Your immune system is activated by aerobic exercise. Managed weight. Your aerobic exercise together with a healthy diet can help you lose weight and keep it off. Stronger bones. Your weight-bearing aerobic exercise, such as walking, can help reduce your risk of developing osteoporosis. Better mood. Aerobic exercise may help you relieve tension and anxiety. It may also help you relax and sleep better. For some people, exercise is as effective as antidepressants at lessening depression. Staying independent longer. Exercising makes you stronger and can help you stay mobile longer. It can also lower your risk of falls and injuries. Fitness will improve the quality of your life as you age. And time spent exercising is better than many of the other unhealthy behaviors we can do, and that helps to regulate overeating. So recommendations for adults are to get at least 150 minutes per week of moderate intensity aerobic exercise, or 75 minutes per week of vigorous aerobic activity, or a combination of both, preferably spread throughout the week. So starting out with as little as 15 minutes of exercise and working your way up to 30 minutes per day, at least 3 days per week, is a good start. Doing that should result in a measurable improvement in cardiovascular endurance in 8 to 12 weeks. We spend less time sitting if we are working out. So even light intensity activity can offset some of the risks of being sedentary. Gain even more benefits by being active at least 300 minutes or 5 hours per week, and increase amount and intensity gradually over time. Physical activity is anything that moves your body and burns calories. So these things include walking, climbing stairs, And aerobic activity gets your heart rate up and benefits your heart by improving cardiorespiratory fitness. When done at that moderate intensity, your heart will beat faster and you'll breathe harder than normal, but you'll still be able to talk. Think of it as a medium amount of effort. So some examples of moderate intensity aerobic activities are brisk walking, at least 2.5 miles per hour, water aerobics, dancing, such as ballroom or social, gardening, tennis or doubles, biking, slower than 10 miles per hour. Vigorous intensity activities will push your body harder and will require a higher amount of effort. You'll also probably get warm and begin to sweat, and won't be able to talk much without getting out of breath. Some examples of vigorous intensity aerobic activities would be hiking uphill with a heavy backpack, running, swimming laps, aerobic dancing, heavy yard work while continuously digging or hoeing, tennis, as in singles instead of doubles, and cycling 10 miles per hour or faster, and jumping rope. So knowing how your target heart rate can also help you track the intensity of activities. For example, for maximum benefits, you want to include both moderate and vigorous intensity activities in your routine, along with strengthening and stretching exercises. As far as clothing and footwear are concerned, you should stick with loose-fitting shirts and shorts or comfortable spandex material that allows your body to really move during exercise. Try moving around to see if you have full mobility in the clothes that you choose to make sure your workout doesn't suffer. You want sweat-wicking fabrics that are the best type of clothing for your workout. These fabrics literally wipe the sweat from your skin, allow it to travel to the outside of your clothes where it evaporates. This way, your body will stay dry and cool, helping you to finish even the most intensive workouts. Polypropylene or silk are also effective in keeping you sweat free. Many people opt for a simple cotton t-shirt when they work out, which also works. However, make sure that the fabric is breathable and not too thick. It's never great to feel slimy after an arduous bout of exercise. What you wear on your feet is just as important as what you wear on the rest of your body. So you want to choose a shoe that supports your heels, arches, ankles, and even the balls of your feet. Without the proper support, your feet may start to get uncomfortable, which can really impact the quality of your workout. If your feet are still uncomfortable, a slip-in insole can provide additional support. And you don't want to forget about socks. The thickness can influence your comfort level during your workout. If your socks are too thick or too thin, blisters can form, which will make exercising much more difficult. So try out different pairs to see which one works the best. And you do want to make sure that you replace your running shoes about every 300 to 500 miles of use, or every 6 months. Other considerations when you're looking at running shoes are whether or not you pronate, overpronate, or underpronate, or what kind of strike you have with your foot. So you can see here in the picture, that top picture is demonstrating overpronation, which occurs when the foot collapses too far inward on the arch with each foot strike. With B, that's a neutral foot strike, and really what you want to strive for. And C, which is underpronation, or also called supination, and occurs when foot strikes are too much on the outside of the foot and have too little inward roll. So when body weight is placed on the outside of the foot while walking or running, it's known as supination. When the weight is placed more on the inside of the foot, it's referred to as pronation. And an easy way to differentiate and remember the difference is that supination has up in the word. And a proper stride, the foot should move from heel to toe with a person's body weight evenly distributed on their feet, giving them neutral pronation. When there is supination, there is an uneven wear on the outer part of the shoe, reflecting the stress of a person's stride. People with supination typically have ankle pain and soreness, shin splints, discomfort on their heels and balls of the feet, and can experience calluses, bunions on the outside of the foot. People who have supination tend to experience more ankle twists and injuries because it is easier for their ankles to roll outward while walking or running. Conversely, pronation is much more common. Pronation is natural and happens because your feet naturally roll inward when walking. It becomes a problem when you overpronate, meaning your feet roll in excessively. This causes the arches of your feet to flatten out over time. Overpronation is shown by uneven wear on the inside part of a shoe's sole. People with overpronation are more likely to experience plantar fasciitis, knee, hip, and/or back pain. So some causes, while identifying supination or pronation is easy, it can be difficult to pinpoint the exact cause. First, many people are born with their feet doing one or the other due to high or low arches or legs that are seemingly uneven, which could be due to hip alignment rather than actual length. However, injuries can cause supination or pronation issues, particularly when discomfort is ignored. When the body is experiencing pain, it is a waving red flag that attention is necessary. Ignoring things like soreness, twists, sprains, leg, hip, knee, or back pain can only exacerbate an injury. Typically, rest is just one remedy to an issue, but not the only remedy. If someone is already experiencing knee or back pain, for instance, they will likely adjust their gait to accommodate their pain, which can lead to overpronation. A third possible can be lifestyle. People who are on their feet for excessive amounts of time, which experience supination or pronation, to try and find comfort and relief. Running may similarly cause issues, particularly when someone trains at a pace that can lead to injury. It is also possible that a person's weight can lead to an uneven gait, especially if someone has recently gained or lost a significant amount of weight and their body is adjusting to the change. The good news is that treatment of supination or pronation is easily achieved, which can help reduce long-term discomfort and susceptibility to injury. The most effective treatment for supination or pronation is a customized orthotic insole and shoes, but note that the need for this to be customized. Over-the-counter solutions will not provide the relief necessary to correct the issue. The first step to treatment is getting a quick foot scan. Chiropractors and physical therapists throughout the country have foot levelers scanning technology in their office and can scan a patient's feet in less than 2 minutes and get the results immediately. A foot scan will determine how someone is distributing their weight on their feet, which informs the design of their customized orthotic insoles. After a scan, an order can be placed for personalized insoles that fit right into your shoes to provide immediate relief and improved mobility. By wearing foot levelers, custom orthotics, the entire body achieves balance, starting with the feet. After a few months of wearing orthotics, the wear on shoes should become more equal, not to mention any discomfort caused by supination or pronation, which will subside as the body regains balance and alignment. Lower back pain, knee pain, and an increased risk of ankle injuries can be greatly reduced, if not eliminated, through custom orthotics. You can also, there are many running shoes that have that are built up in certain areas depending upon what kind of strike that you have. And so going to like Elite Feet or something, a running shoe store, can help you with selecting the right shoe. They may have you walk barefooted for a certain distance to determine what kind of strike you have, and you can go from there. Cardiovascular workout equipment is used to facilitate physical activity that the human body can utilize to promote good health, lose weight, and even relieve stress. Achieving an aerobic effect through the use of piece of cardiovascular workout equipment tends to be very efficient, and that an individual can quickly increase their heart rate to their target heart rate and thereafter maintain that level for a minimum of 20 to 60 consecutive minutes. By doing so, you allow oxygen to flow freely throughout the body for the majority of the exercise routine. There are multiple ways in which the body can achieve an effective aerobic workout using a variety of cardiovascular workout equipment. And there are a variety of cardiovascular machines available that are designed to allow the human body to achieve an aerobic workout. In addition, cardiovascular equipment promotes stress relief and minimizes the effect of depression. Treadmills are designed to allow the user the ability to walk, jog, or run, all while indoors. Treadmills have been proven to burn calories per time spent, more calories per time spent than any other cardiovascular machine that are similarly categorized. The reason for this is the versatile workout that treadmills offer, such as the running and walking options, as well as the option to do either an incline or decline. Treadmills also offer constant speed options that allow users to perform a workout that is ideal for maintaining an elevated heart rate. Working out on cardiovascular equipment is also a great way to relieve stress, reduce anxiety, and decrease symptoms associated with depression, all while improving cardiovascular endurance and sustained stamina. Another effective piece of cardiovascular workout equipment is the stair climber. The stair climber mimics the action of walking upstairs. These machines offer a more challenging workout than a treadmill and may cause individuals to become fatigued very quickly. You can program the settings for the stair climber so that the level of difficulty parallels the physical capability of your patient or client that you're working with. Stair climbers are not only effective at working the muscles associated with the legs, but also at causing the human body to expend a higher level of energy as well. This directly results in more calories burned during a workout. Individuals that suffer from back pain should consider an alternative type of cardiovascular workout equipment, as stair climbers may exacerbate that pain. So elliptical machines provide an ideal full body workout without the impact of running. Elliptical machines are essentially a combination of stair climber and a treadmill. As with aerobics, it is highly recommended that each individual work out on each of the various types of cardiovascular equipment to determine which pieces of equipment best support their fitness goals. And you can see here that they're demonstrating proper exercise technique on an elliptical trainer. You want to make sure that your client is looking up and forward and looking straight ahead with torso balanced over the hips with no excessive forward lean. Stationary bikes are another great way to exercise the lower extremities of the human body and achieve an aerobic effect at the same time. Stationary bikes are quite popular among fitness seekers, and many individuals use them at the beginning of their workout routines as part of a warm-up. And really, you're using, again, the lower body. The nice thing about it is not non-weight bearing and non-impact. Now, if you have someone who has osteoporosis and they're needing some weight bearing, this might not be the best choice, or you want to do it with a combination of weight bearing type of activities. With elliptical, where there's non-impact, but still weight bearing, or with a treadmill. Some stationary bike models allow for movement of both the arms and the legs, thus allowing several major muscle groups the ability to achieve a complete workout. All stationary bikes provide an aerobic effect, calorie burning, weight loss, and muscle strengthening of the lower extremities. And you can see here the upper body is supported in a seated position on a semi-recumbent bike. The seat is adjusted to allow a slight bend at the knee, which is similar to the situation with a standard stationary bike. Here you see a group exercise bike, and the position is based on the 6 contact points of the body. These are great for high energy motivational instructors and invigorating music and visualization that come together to make up indoor group cycling classes that make them both fun and effective. Group cycling has no complicated moves to learn to frustrate participants. And it's the ability to work at your own pace that means everyone can get the best of the session regardless of how fit, flexible, or coordinated they are. You don't necessarily need to know how to ride a road bike. You simply saddle up, set the resistance to the level that's right for that person, and let the instructor guide them through an incredible ride. The group cycling classes makes riding stationary bikes more fun by adding variety and visualization to the workout. And a motivating group setting with energizing music and inspiring instructors makes group cycling an incredible experience. While you don't necessarily need special sportswear to get started, investing in padded cycling shorts and tops made from moisture dispersing fabric, like we talked about earlier, will make riding more comfortable and help you to get the most out of your workout. Workout intensity is varied throughout the class by changing body position, pedal speed, and resistance when instructed to do so by the instructor. The music is used to motivate to keep energy up and push the individual to the max. Group cycling classes can burn up to 900 calories over a 75-minute workout. Aside from the group energy, one of the things that makes group indoor cycling classes so much fun is the bikes themselves. And so they are often equipped with weighted flywheel in the front that picks up speed as you pedal, and the seats and handlebars are adjustable, so you feel like you're riding on a real bike. The group cycle is ideally suited to group cycling class, and really looks at the biomechanics associated for particular bikes. So wearing a heart rate monitor oftentimes can help get more out of a workout and can give feedback during and after exercise using parameters such as heart rate frequency, speed, distance, and calories consumed. The cadence is important. That's the speed at which the pedals turn, and it's an important principle of indoor cycling. Pedaling at higher rate expends more energy than pedaling at a lower rate with the same resistance. Optimal cadence is between 80 to 110 revolutions per minute for normal cycling. An upper body ergometer, or UBE, is a piece of exercise equipment that, as the name suggests, works the upper body. It also measures the work of the upper body muscles during exercise. Often referred to as an arm bike, it uses a cycling motion like a bicycle, except that you pedal with your arms. The arm pedaling motion provides a cardio workout that improves cardiovascular endurance and pulmonary function. It also is a strength workout, one that strengthens the muscles in the chest, back, arms, shoulders, and core. Upper body ergometers are often used in physical therapy for clients recovering from injuries such as wrist, elbow, or shoulder fractures, or from surgery. Those in cardiac and pulmonary rehab use upper body ergometers as well. In addition to rehab, upper body ergometers are also used in fitness settings. Members use them as a cross-training option or a way to add variety to their workouts. And upper body ergometers are a user-friendly option for members who have limited body function or who use a wheelchair. When it comes to exercise equipment features, accessibility and versatility are essential to addressing the needs of a wide range of users. And that holds true for upper body ergometers. Traditional upper body ergometers offer a seated workout. Others also provide access for standing and or wheelchair users. However, these models require seat removal and typically staff assistance to remove the seat. Then wheelchair users must navigate and overexposed seat rails to approach their ergometer. Standing users have to straddle the seat rails as they exercise. So there are different models that you can use and to help with that. Other types of cardiovascular workout equipment include rowing machines, which promote a full body workout, as well as the ability to achieve an aerobic effect. Each individual needs to utilize the proper form when using the rowing machine, as this will ensure that all major muscle groups are worked as intended. Physical activity or aerobic exercise is any non-stop activity that uses your large muscle groups and makes your heart and lungs work harder. So there are some examples such as walking outdoors, running, jogging, hiking, swimming, dancing, cross-country skiing, aerobics, or group exercise that are great options as well. With race walking, it is an event that's contested in all levels of the sport of track and field, from youth athletics up to and including the Olympic Games. It produces less impact and is typically demanding and is technically a demanding event that continues to grow in popularity across younger and older age groups for its fitness and competitive aspects. Race walking differs from running in that it requires that you maintain contact with the ground at all times and requires the leading leg to be straightened as the foot makes contact with the ground. It must remain straightened until the leg passes under the body. Judges evaluate the technique of race walkers and report fouls, which may lead to disqualification. All judging is done by the eye of the judge, and no outside technology is used in making those decisions. But you can see with walking, of course, making sure that you're using proper walking techniques, something we've gone over. And so making sure proper body mechanics, and race walking is just, it's a little faster. It's like fitness walking. Jogging may have a slower pace than running, but it still boasts a range of health benefits. So while jogging, maintaining good posture and engaging the core and gazing forward, avoiding tilting your head down and broadening your chest and keeping it lifted as you draw your shoulders down and back. You want to keep your hands loose and use a relaxed arm swing. Avoid crossing the arms in front of the body. To prevent injuries to the lower body, use a mid-foot strike and avoid hitting the ground with the heel. This allows your foot to land directly under your hip as you drive your body forward. A heel strike may cause your leg to slow down your stride and stress your knees. With sprinting, the high-intensity action of sprinting requires a lot of muscle activation and explosive force as you develop a powerful stride. So some things to do with that are to slightly lean forward from the waist while engaging the core. Lift the chest but soften the shoulders and draw them away from the ears. You want to use short, fast strides to conserve energy. And also to reduce your chance of injury, make sure that you land softly and quietly with minimal impact. Use a 4-foot strike and propel yourself forward from your toes. With each step, you lift your thighs so it's parallel to the ground. Bend the elbows at a 90-degree angle and draw them straight back and forth using an exaggerated movement and moving them through a wider range of motion than when you jog. Raise your hands as high as your chin and back toward your low back. And avoid rotating your torso and bringing your arms across the midline of your body. If you're running on a treadmill, it's great because it helps to reduce the impact on the joints and prevent overuse injuries. A treadmill also allows you to run at a smooth, steady pace without any hindrances or necessary stops. It also allows you to focus solely on your form. So with that, making sure your shoulders are back and engaging your core as you slightly lean forward. Maintain an erect spine and keep your shoulders directly above your hips. Relax your arms and gaze straight ahead and avoid looking down at the monitor. Use a short stride and take small steps. Running on a treadmill will force you to shorten your stride since overstriding will cause you to kick the front of the treadmill. Unless you have concerns with balance, avoid holding on to the rails as you run. Swimming is a healthy activity that you can continue for a lifetime. It is a low impact activity that has many physical, mental health benefits. You can see here the subtle S-shaped hand pattern that's used during the power phase of the front arm crawl stroke in swimming. But there are other strokes that you can use as well. Swimming is a great recreational activity for people of all ages. Recreational swimming can provide you with a low impact workout, and it's a great way to relax and feel good. Some common swimming styles in recreational swimming are the breaststroke, backstroke, side stroke, and freestyle. There's also the butterfly. Some people who enjoy swimming want to take it to a competitive level. That can provide the health benefits of a vigorous workout as well as the fun and thrill of competition. Main strokes used for competitive swimming are breaststroke, freestyle, backstroke, and butterfly. Distances swum in competition swimming can vary from 50 meters in a pool to much further distances in open water. And swimming is a great workout, but you need to move your whole body against the resistance of the water. Swimming is a good all-round activity because it keeps your heart rate up. It takes some of the impact stress off your body. It builds endurance, muscular strength, and cardiovascular fitness. It helps you maintain a healthy weight and tones muscles and builds strength with the resistance of the water. It provides an all-over body workout used during swimming. Swimming has many other benefits in that it is a relaxing and peaceful form of exercise and alleviates stress. You can also work on improving coordination, balance, and posture, and improving flexibility. It provides a good low impact therapy for some injuries and conditions and provide a pleasant way to cool down on a hot day. Being available in many places, you can swim in swimming pools, beaches, lakes, dams, and rivers. Just make sure that where you swim is safe. Getting started at swimming is very easy. You can do it as a sport for all age groups, skills, and fitness levels. Group exercise is another form of exercise cardiovascular. Generally, these classes are 45 to 75 minutes in length and include a warm-up with dynamic pre-workout stretching, aerobic activity, cool down, and post-workout stretching. There are combinations of impact styles with low impact, where one foot remains in contact with the floor, or high impact, where both feet leave the floor during various activities. And really just depends upon the types of activities you want to include. Some do require some running or CrossFit type activities, some calisthenics, jump rope, and could include some hiking. Some low impact classes might include some cycling, maybe some yoga, some walking, some spinning, or Pilates. And there are other group exercise activities, dance, like Zumba, ballet, that are good as well. Some high impact exercise, of course, is going to help strengthen bones and increase bone density, more so than low impact. And your high impact can also be high intensity, where you're getting heart rate up and burning calories more so than more leisurely type exercise. So depending upon your client and who you're working with as to what they need. These kinds of exercise can also help strengthen joints by building the muscles around the joints. And you want to make sure that you start out slowly and build up to that. Step aerobics is another opportunity for an up-tempo way to get your heart pumping and stay fit. It is a choreographed cardio workout as part of a group exercise class that can help build motivation and create a sense of community. You can also do it on your own as long as you have an adjustable step or similar cardiovascular exercise, but without putting a lot of stress on the joints. There is some impact, but it's fairly low impact by nature. It does burn great calories and can be a great mood booster as well as energy levels, and really targets the overall body and building strength and flexibility. Can help to improve balance, coordination, and agility. And there is a big social component of a group class that's beneficial in forging new connections and helping to raise motivation levels. Step aerobics is helpful in managing blood pressure and diabetes, and people with osteoporosis or osteopenia can do this type of low impact exercise to improve bone strength. People with arthritis can use a chair or stable object for extra balance during a step class. Cardio kickboxing workout is one of the most fun, fat-burning, high-energy exercises that you can do, with up to 1,200 calories burned during a 1-hour class. It is a mixture of martial art-inspired group fitness format that is both heart-pumping and exhilarating, using punches and kicks from disciplines such as karate, Muay Thai, and traditional boxing. Group fitness participants worldwide have fallen in love with this class format. And cardio kickboxing is a total body workout that involves utilizing multiple muscle groups to elevate the heart rate and train participants in speed, agility, and quickness. In most cardio kickboxing classes in the movement prep segment, participants will be introduced to the proper technique in executing the 4 main punches: jabs, crosses, hooks, and uppercuts. In addition to punches, cardio kickboxing participants will also learn how to safely perform the kicks used during class. Front, side, back, and roundhouse kicks are the most commonly used kicks in cardio kickboxing and will get your heart rate elevated. You may find that some cardio kickboxing classes will also involve contact. These classes will integrate equipment such as boxing gloves, pads, jump ropes, and even heavy bags to enhance the in-class experience. Participants may work in pairs, simulating boxing rounds, or work on individual heavy bags, performing punching and kicking drills. Incorporating these additional tools will create a kickboxing atmosphere that will psychologically engage participants and in some instances increase the intensity of the workout. Cardio kickboxing is another group fitness format that has branched off into boutique fitness centers where focusing on a consistent member experience is a priority. Complete with standardized programming, the use of heart rate monitors, these facilities have been popping up all over the country. A beginning cardio kickboxing workout should take the participant through safely executing the stance, punches, and kicks used during the body of the workout. The stance can face forward or slightly to the side with one foot, more of the fighter stance. And either of the two stances, foot placement should be at least hip width apart with the knees slightly bent to provide a stable base. Core muscles should be braced or isometrically contracted. Shoulders are somewhat rounded forward or protracted, and elbows bent and close to the torso with fists about chin level. Water aerobics is the performance of aerobic exercise in water, such as in a swimming pool. It is done mostly vertically and without swimming, typically in waist deep or deeper water. Water aerobics is a form of aerobic exercise that requires water immersed participants. Most water aerobics is in a group fitness class setting with a trained professional teaching for about an hour. The class focuses on aerobic endurance, resistance training, and creating an enjoyable atmosphere with music. Different forms of water aerobics include aqua zumba, water yoga, aqua aerobics, and aqua jog. The benefits of water resistance training associated with water aerobics includes the activation of opposing muscle groups for a balanced workout. The push and pull of the water allows both increased muscle training and a built-in safety barrier for joints. In fact, before water aerobics, injury therapy was used for benefits of water. The water also helps to reduce lactic acid buildup. Although obvious benefit to water exercise is the cooling effect of the water on the system, the average temperature is around 78 degrees in a group fitness pool. This temperature will force the body to burn calories to stay at homeostasis while also maintaining a cool, comfortable atmosphere with less sweat noticeable to the participant. A water aerobics class can incorporate flotation devices, as you see here. The mitigation of gravity makes water aerobics safe for individuals able to keep their heads out of the water, including the elderly. Exercise in water can also prevent overheating through continuous cooling of the body. Older people are more prone to arthritis, osteoporosis, and weak joints. Therefore, water aerobics is a safe form of exercise for those conditions. Although it's not necessarily weight bearing, research studies can teach us about the benefits the elderly can receive by participating in water aerobics. In a study done in Brazil, effects of water-based exercise in obese older women, the impact of short-term follow-up study on anthropometric, functional fitness, and quality of life parameters, the effects of long-term water aerobics was tested. Although it didn't conclude exactly as planned, their test subjects did experience improved aerobic capacity, muscular endurance, and better overall life quality. The water also provides a stable environment for elderly with less balance control and therefore prevents injury. Water aerobics has a few disadvantages from a practicality standpoint. Aqua aerobics requires access to swimming pools via facilities, and in addition to any membership fees to access facilities. Classes may cost extra. Although aquatic exercise greatly reduces the risk of injury, it is typically seen that not as many calories are burned as would be in some other weight-bearing type activities. Though aquatic activities in general generally expend more energy than many land-based activities performed at the same pace due to the increased resistance of water, the speed with which movements can be performed is greatly reduced. These are my references. Thanks again. I look forward to talking with you soon. Have a great day.